15 minutes into just kind of general discussion that we invite you to participate in. So without further ado, I'm going to introduce Kelli. So Kelli Brien is a certified doula, childbirth educator, and lactation specialist. She created the Speak Life Doula program and co-authored the Safety PIN grant submission that garnered multiple awards from the Indiana State Department of Health. Kelli founded In Full Bloom Maternity Service and Mahogany Maternity, which serves hospitals, home births, and birth centers for over 14 years. And Kelli established the 32nd Milk Bank Depot in Indiana. Kelli serves on the St. Joseph County Fetal Infant Mortality Review Team, the Indiana State Department of Health Maternal Mortality Review Team. She's on the board of Mental Health Awareness of Michiana and chairs the Birth Equity Subcommittee for DONA. And what does DONA stand for?
It's just DONA now. It used to stand for Doulas of North America, but now we're international, so now it's just DONA.
Okay, excellent. And Kelli serves as the Director of Diversity, Equity, and Inclusion for the Birth Equity Group.
For DONA International as well.
For DONA International, excellent. And she has co-founded Birth Equity and Justice, St. Joe County, and has testified at the Indiana State House in the House and Senate chambers in support of Senate Bill 416, which passed to be signed by Governor Eric Holcomb. And Kelli, I actually don't know what Senate Bill 416 is, so I wonder if you would like to tell us a little bit about that and then lead into your discussion today.
Yes, thank you. Thank you so much, Lisa. That bill was to have funds for doulas to be funded by Medicaid, because we know that doulas make a huge difference in outcomes where maternity is a concern. And so that's where that bill landed. Unfortunately, it has not been funded. And so work for that is still yet underway.
Okay. Great work.
Thank you.
Okay, well, I'm turning it over to you, Kelli. So thank you for being here.
Thank you for having me. Welcome, everyone, and thank you for joining us. I'm really excited to be discussing mental health and maternity with you all today because it's a very important topic. It's near and dear to my heart and my work, but I think as we discuss this, we'll discover that it should be near and dear to everyone's heart. Whether or not you're a mother, there's someone that you love that's pregnant or could become pregnant, you may yourself become pregnant, or there's somebody that you're connected to where these topics really hit home. So I'm going to first talk about the connection between maternal and mental health. So to be frank and to be casual and open and share with you all, we're going to really discuss things in a very candid way today. I like to be open and I like to make sure we're all comfortable. I want to start by saying that maternity starts in the mind. If you want to learn or understand anything, you start at the root, you start at the beginning. And the beginning of maternity is in your mind. What it takes to create a child starts in your mind. Sex begins in your brain. It begins in your head with your thoughts, with your dreams, and the desire to build a family. Unfortunately, sometimes we become pregnant and it's not a dream. It's not a fantasy. It's not what we want. It wasn't our goal. So mentally, why we get pregnant, how we become pregnant, that takes a toll. That has an effect on our overall maternity. Many pregnancies are unwanted. And those that are wanted sometimes can come with stress because maybe if there was infertility or maybe advanced maternal age, maybe those play a role in when or how you become pregnant. If there was IVF, in vitro fertilization, and all of the things that go along with that add to the stress of what goes on in the body during the beginning stages of maternity. And so, you know, we talk a lot about folate and folic acid and preparing your body for pregnancy and health and prenatal vitamins and seeing the doctor. But those are all things that should come secondary to what's going on with mom's mental state, with her surroundings, with her atmosphere, because we are beings that are social. We're social beings. Everything that has to do with maternity is actually social as well. And so our emotional state, our mental state, all depends on our, number one, feeling confident in our autonomy. Do I feel safe in my body? Do I feel safe in my mind? Where do I feel as though I could use more support? Where am I afraid? It's one thing to desire a pregnancy and then to look at that test and to realize that you have in fact become pregnant. That's a whole nother thing, because now for the rest of your life, you will have been pregnant, no matter which direction this goes. If there's a loss for any reason, you will always have been pregnant. And so at that point, you're a mother, you're a birthing person. And so the thought of that and the permanence of that and the depth of where that goes in your psyche is definitely a subject and a point that we really need to discuss more, not just in our health providers, but in our homes with our children as they grow, as we're teaching about puberty and all of these different things that are happening with the body, social skills and all this. We need to be having these discussions about what it means to become pregnant. What happens in your body with hormones, the hormonal changes that happen, what happens with your mood, and how the atmosphere is set surrounding the people who speak to you. Quite often in my practice, I'll speak to moms and they'll express their frustration with people just reaching out for that pregnant belly, complete strangers, just deciding that, oh, there's a belly, I should touch it. There's no other process in our lives that we do physically where people invite themselves in that way. So imagine that you're doing any other process, whether it be eating, whether it be eliminating, and imagine someone saying, oh, let me tell you how to do that. Or, oh, let me touch, that's interesting. That would be a faux pas, would it not? But for whatever reason, our society has made it a norm or something that's not necessarily frowned upon to reach or to expect to be able to touch a pregnant woman's belly. And so I say that to just kind of give you an overall basis of how our emotions can be encroached upon, how we can have tiny microaggressions that may not even appear in the beginning to be that way, but can come off that way. So your mental health can really be affected by these things, little by little by little. A mom begins with the thought of maybe I am pregnant. And then you think, well, who am I going to tell? What will their response be? How do I justify this if for whatever reason I feel as though I shouldn't be pregnant now? Maybe my partner did not want this, or maybe the situation surrounding my pregnancy is not what I wanted, is not safe for me. So all of those things, all of those ideas and all of those thoughts surrounding maternity are things that we have to keep in mind and to discuss and to delve into to be sure that we are providing a safe place for maternity, not just in the doctor's offices, but in our homes and in our communities. Wherever maternity is discussed and dealt with, we need to keep in mind mom's mind. That needs to be at the forefront of how we deal with mom. So then moving along and finding out that you are pregnant and going to the doctor, discussing what all that means, when you're able to be seen and what it takes to sit down with the doctor and to, for the first time, be examined and learn what all that means. Because we know that when you turn on the television and you see a birth or you see a labor, there's fear. There's fear surrounding maternity from centuries and centuries. We've become a society that treats birth as though it's a medical emergency. I'll put it to you like this. And again, I've warned that I'm going to be candid. Imagine that you are preparing to make your dinner, or you're preparing to eat, or you're preparing again to eliminate, and someone tells you when you can or should or shouldn't do these things. That doesn't feel right. It doesn't sit right within your body. It feels intrusive. and it feels aggressive, and it can feel scary and controlled. So taking that idea and going in to see your provider and having your provider ask you things such as, how many children do you want to have? Or are you considering birth control? Well, these are questions that should be had in discussion as long as we have already had other discussions about how mom is feeling. What are her thoughts surrounding this birth, this pregnancy? Some moms that are seen may not want to parent. Babies may be given for adoption. And so if that's the case, there may be discussions or subjects or ideas or things that she may not want to discuss. It may send her into an emotional state that's not comfortable for her. So what's really important is to keep in mind, bear in mind that this is more than just, I have a baby growing in my body, let me keep baby safe. Let's make sure that baby is healthy. We have to also take into consideration that mom's health is how baby got here, right? We'd have no baby without mom and dad. Without the birthing person, without this family, this baby would not be there. So we have to make the family, we have to make the home, we have to make the community, we have to make wherever we're birthing and all of our care a safe mental atmosphere, right? Very often, women may come across situations where they're seeing many multiple providers, and they don't know even for sure who is going to be there in the birth with them or how many times they'll be able to see this provider. Whether or not they're comfortable with that provider is usually not even discussed within the practice. Does a mom say, I'd really rather not see this provider from this practice because I was made to feel uncomfortable? Well, if they're in the rotation, does mom have that? Does she have that autonomy? Does she feel and know and understand that she does have that right? How often do we discuss mom's comfort with a provider? So these are things that we really have to keep at the forefront of our minds as we're talking about maternity overall, right? And what we know too is that now the way things are set up with Medicaid, that when a mom is finding out that she's pregnant, her providers that are available to her for maternity services, those numbers are starting to dwindle and dwindle and dwindle in our community, right? So not being able to have a large variety or a wide scope of providers to pull from is a really difficult situation for mom, because if she feels as though she's not safe, she's less likely to go to her provider. She's less likely to ask questions. She's less likely to be able to feel comfortable. And then when those stress hormones and that cortisol rises within her, you've already started this cycle of pain, of fear, and of holding back, right? So risk of prematurity shoots up when there's high anxiety, right? So making sure that discussions are had throughout her community, throughout her home, with her partner, with her family, to make sure that she's feeling safe. I'll reiterate that over and over. So not only how and why we become pregnant are key, but the idea around her comfort physically. So I have personally been in many births where there was stress involved because of the atmosphere, right? And so my job as a doula is to say, what can I do to eliminate any and all distraction and anxiety and stress and fear that is surrounding this mom right now? Multiple times I've been faced with situations where mom did not feel safe in her birthing area. The entrance of someone who has hurt her emotionally can trigger the fear, the fight, flight, or freeze syndrome, this activity in her brain where she shuts down. And there have been multiple times where labor has stopped, seized, and halted because mom did not feel safe. Imagine a mother being in the woods, being out in the wild, and she goes into labor and sees a bear. Well, if she sees that bear, her body is going to seize that baby and desist in all operations to birth, right? Because she's got to head out of there. She's going to run to her safety. And by the time she gets to safety and calms down, she's able again then to restart labor. Well, that happens quite often in situations where there's no bear, but the bear becomes a provider, an abuser, someone who has been intrusive, or an intrusive thought that causes mom to release that cortisol, that anxiety, that adrenaline in her system. And she is no longer prepared to birth in a safe place, but she feels as though she has to hold back to be safe. And it's very important that we recognize that, because quite often, not just providers, but partners and people who are loved ones and mean well can pressure mom. Oh, she hasn't had that baby yet. You know, the pressure to, oh, she's in labor. Call me when the baby comes. Has the baby come yet? Text me. Even those well-meaning ideas and thoughts and sentiments can add pressure and anxiety that is undue, that can slow labor down, stop labor, and really cause harm, you know, even if it's unintentional. So making sure that mom feels safe is number one. Another way to understand what's going on for providers, a wonderful way to be able to kind of identify where there are issues, is discussing touch and saying, this is what I have prepared for you. This is what is standard for your care. How do you feel about this? Is it okay if I touch you? Okay, I'm going to touch now. This is what you should experience. And if you have an issue, please let me know. Quite often, when moms are not asked and invited in to be the head of her birthing team, then there's already that feeling of that white coat syndrome where I'm afraid, or I feel like it is me versus them. It's an adversarial situation where mom feels like she has to defend herself. And that's the wrong headspace to be in for maternity. It's a bad headspace for anyone, but especially during maternity. So asking permission to touch, explaining what's happening, and finding out her responses to that. How does she respond to that emotionally? Because sometimes, you know, mothers can be deemed non-compliant because they don't want to do what's being asked of them. But the root cause of that issue may be she suffered abuse. She suffered sexual abuse. She's scared to become a parent. She's cold. She's simply desiring her mother. There's so many issues that can be behind there. And the thing is, we may not be able to solve them, but understanding that they are there, understanding that there is something that's giving her pause, can give us a minute to breathe and say, if you're not comfortable with this at this time, here's an alternative. And if there is no alternative, we will pace with you. What can I do in this moment to assure you that I'm a safe place for you? Right? And it's really important because, again, when mom releases that cortisol and that adrenaline in her body, everything tenses and it's more difficult for everyone to be able to communicate. And communication is absolutely the key in care. I'm going to say that again. Communication is the absolute key in care. Myself as a doula, there have been many times where I have sat down with clients and I've talked about their ACEs score. And if they don't know it, we do the test and we discuss it, what it means to have adverse childhood experiences. So this is a test of, I believe it's about 10 questions that, it may be more 10 questions actually, but you get a score between 1 to 10, 10 being extremely high for adverse childhood experiences. And those mark and can set you up for stress later on in life, really bad outcomes mentally and socially and emotionally further down in life. And so if a client has presented with high stress levels and she's presenting with issues that are saying, there's something going on, we talk about that. Do you feel safe discussing with me your needs where your touch is concerned, or your needs where this word is concerned? There may be a trigger word. There may be a trigger touch or a phrase that sends a client into a bad place, and it may affect her care. When somebody who is a provider is simply just reaching to touch and give comfort, it may give mom pause. And then there may be not just a pause, but this aversion to your provider. And so that's not what we want. We want that communication. So it's really key to understand that these exercises in learning about our emotions are very important. Offering clients the opportunity to take the test and know their score and know that that may help to have them understand their own mental capacity and where they are, and then to suggest and refer them to treatment and help and support. Another resource is the PHQ-9. That's another test, and the Edinburgh Depression Scale are available. I want to talk about body autonomy as a right in maternity as well. So again, we've already touched a little bit on what it means to touch and to ask permission to touch, but where mom's rights are concerned, it's a greater issue, right? So a lot of times moms find that they're not being given informed, they're not giving informed consent. A lot of times moms are told what is going to happen to them or what's going to be done to them, rather than offering this treatment as something that is standard and something that I recommend. How do you feel about that? How does that sit with you? This is your body, and you have a choice to decline or accept this treatment because you do have rights. Right. I have a resource on my webpage, the Birthing Bill of Rights at mahoganymaternity.com. And you can check that out. And I share that with clients. I share that with parents. And I share that with people who need to understand that your provider is your provider. You are a consumer. You have chosen to give your care over to this person as part of your team, right? Yourself, your partner, and your provider are a cord of three. Right? Well, and actually with your doula, that's a cord of four, right? And so what's important to remember is that in the core of that, at the very center of that team, is this birthing person's body and their mental state. So it's extremely important to understand that this person has body autonomy. Don't touch means don't touch. No check means no check. Clearly, if there's an emergency where there's a life or death situation, you're not always able to have deep conversation. You're not always able to have the time to spend on asking these questions in a way that gives total and complete comfort. But being able up front to say, this is what informed consent is. I give all of the information available about what I know about your body. And I'm giving you all of the information that is available about what my care looks like. And then I am making sure that you understand how that affects you in every way. And then you have the choice to ask those questions, right? Because then you know what questions to ask. If the client does not know which questions to ask, giving more information in small bites to say, this is what care looks like. This is what we're seeing from your body, from what we know. Let's talk about this. This is what I recommend. How do we move forward? Giving birthing people that choice and that conversation is not empowering, because we cannot empower someone. They're already empowered. You can't give someone what they already have. It's expressing to them that you're recognizing their power. Again, we cannot empower birthing people. We cannot empower women. We can recognize the power that is inherent within a woman to do what it takes to get herself through maternity and support her the best way that we possibly can. And so understanding that informed consent can really make or break a communication gap. It can cause a chasm, or it can relieve and close a chasm between the provider and the parents. It's so important. The other part that is not mentioned a lot is the role that the partner plays in mental health, right? Because we know that partners are definitely going to make a difference. Studies show that postpartum depression in one partner puts the other partner in a direct risk. There's a correlation between mom's postpartum depression and dad's postpartum depression, or partner's postpartum depression. They tend to follow each other and affect each other. So knowing that dad is healthy and that mom is healthy, knowing that they're able to kind of see and talk to each other and being able to communicate to say, I don't feel well. And then to be able to understand how that affects care, because if they bring stress into the room and mom is looking at dad and seeing his stress because he's afraid, and then she becomes afraid and they're not sure how to comfort each other, then there's this big chasm of communication between this family and the provider, where now there may be pushback, where now there may be ill feelings because we didn't bring dad in and include him in the conversation and include him in how his feelings affect her feelings. Because if he's grumpy and upset because he's afraid, and maybe he speaks coarsely to her, and then she's sent on this flood of emotions of sadness and depression, well, this is a cycle that could have been broken from the beginning, because all that communication and support can change that. So knowing that partners play a huge role in maternal mental health is important as well. And that also stems in body autonomy, because asking her and making sure she's comfortable then honors the partner to say that you're not just reaching and touching my partner, you're not encroaching upon my partner's body, you're being respectful, and that in turn respects me as well. The other part that I want to touch on is making sure that parents know how to provide and to prepare for each trimester. And there's questions that I want to pose for parents to have and providers to understand and maybe have on hand as well, to ask about each area, each trimester. How do you prepare, right? So questions to ask are, when and where and with whom do I feel safe and comfortable? How do I make my atmosphere comfortable? Who makes my atmosphere comfortable and or uncomfortable? And how do I eliminate the discomfort as much as possible? What are my non-negotiables? Are they non-touch with this or not this word, not this phrase, not this provider? What are my non-negotiables? Because introducing a non-negotiable into the birthing room can create havoc, wreak havoc on this mom and this baby and partner's experience. What do I need to feel safe and secure mentally in my relationships and atmosphere? It may be that I have to pause and not tell certain family members that I'm pregnant until I am in a safe place and I'm in a position where I don't feel I have to defend myself or my pregnancy. And I'll put a note here that providers should be very careful when discussing things such as birth control. It needs to be a desire, a discussion that is open, that's not prodding or poking or saying outside of it being a safety or health issue, this should happen or you need to do this. This needs to be a conversation that includes body autonomy. The last question is, if I feel unsafe, where do I go? Who is my support? Who do I tell? I tell many of my clients to have a safe word. If they don't feel as though the situation is keeping them safe or they feel threatened, what word do they share with their partner or with their provider to say, I need to pause, I need a moment? And that word might mean, please ask the provider to step out because I need to cry, or I need to discuss this with you, or we need to pray together. I just need 5 minutes, right? So with that, I want to open it up because it's 12:30 and I want to honor our time and invite Lisa in to kind of ask questions or go from here.
Yeah, thank you, Kelli. There's a lot in what you just went through. I'm wondering if there were a couple questions that I had prepped, but this one actually is based on what you just said. So during COVID-19, right, that has affected how many support people are allowed in labor and delivery in the postpartum room. I'm wondering if you can speak to, this idea of somebody having a support person present. What have you observed? What, presumably COVID-19 restrictions will go away in the next, hopefully, few months. But what are you seeing in terms of people having adequate support in the hospital setting or clinic setting even?
Thank you so much for that. And I'm so grateful that that question has been posed because it's a huge situation. It has become a health crisis again. And there's another layer of maternal crisis because what has happened with COVID is that it has exacerbated all of the barriers to good care. It has exacerbated the issues and the barriers that we have had to safe labor and maternity across the board, especially those that affect Black women, because the absence of that safe person, that support person, means that there is no safe place to land during labor when you're with a provider. You may not feel comfortable with asking questions, or you may just feel nervous. It may be a situation where you feel pressured into something that you would not have otherwise given permission, or you may not be able to ask questions because you don't feel like there's anyone there to witness what's happening, and you don't want to upset the provider. Again, there's that white coat syndrome, that lab coat syndrome, where this provider is a authority figure. And then with blocking partners coming in, they become more of a authority figure because they're saying no to your support. They're saying no to your shoulder to lean on. And so not only do you not have that support, but you don't have that witness when something goes wrong, or if there's an injustice that happens, or if there's a mistake that happened, and there's a question that needs to be asked, you're not seeing. So many times I've seen providers reach for the scissors to do an episiotomy, and mom physically cannot see what is happening. And so situations like that happen, and who is there to halt or to slow down or to ask questions or to warn or to comfort in situations where mom feels like this provider told me so that I have to. COVID has exacerbated that. And with the mass exodus of support from the hospitals or from where moms are giving birth, it has become more apparent the injustices that are happening. They're being brought to the top, to the surface more often now, because it's kind of I hate to say it this way, but I'm being candid, it's kind of a free-for-all, where now you don't feel like you have that backup. And even the idea of having someone there gives you more courage, right? I feel more safe when I'm holding this hand. Whether or not this hurts, the safety of this hand, this warm hand of someone I love being next to me, gives me comfort. And now that there's no one's hand to hold, and this is the doctor that was pushing for birth control, and this is the doctor that doesn't like that I won't lay on my back, what's going to happen to me? Right. So what I have seen, even in some of the hospitals that I've worked in, where I've had a nurse say, "Oh, we're so sorry, you can't get into the water because the water amplifies the COVID virus." So the issue that is one of the issues with that is it's not evidence-based. It's simply not true. Had I not been there and asked that individual to repeat themselves, and they did, this would have been something that maybe the parents might have researched or maybe not. But to say, let's look at that. Let's dissect that. What does that mean? Because we want to understand why we're getting a yes or a no or a suggestion. And so with COVID, it has opened up the doors, opened up the floodgates to this view, to showing the disparities that are already there and the injustices that have always been there. But now it's like, there's this free for all.
Thank you, Kelli. There is a question about if you could please explain what a doula is and how a doula works with providers. And I actually wanted to piggyback on that question and ask, why are doulas important, to communities of color and people of color especially? So if you could kind of just talk a little bit more about doula support.
Absolutely. And that is the number one question I've been asked throughout my entire career. And I forget to start with that, so forgive me. Doula is a word. It is Greek in origin, and it means servant or one who serves, right? And so the position of a doula is one of education and support and advocacy. So this is someone who supports you from the time that you're pregnant all the way until you separate in your relationship. And that can be when the baby is born, or if you're a postpartum doula, it can mean weeks or a couple of months after baby is born. This is someone who provides childbirth education. This is someone who provides information and referrals on resources in your community or nationwide, wherever the case may be. This is someone who also understands how inner workings work. So discussing with you your providing for you an understanding of what your rights are, and also providing insight into what it looks like to walk into the birth space if you're going to the hospital, what labor looks like if you're doing a home birth, what it looks like to birth in your community, for you, for your family, and supporting that no matter what it looks like. So this is a birth coach, but this is also someone who walks with you throughout your whole entire maternity and a good portion of your postpartum as well. Oh, and the reason that they're important, I'm sorry, the reason that they're important, especially for Black communities, is because we know that there are racial disparities in the infant and maternal mortality issues that we're facing. So Black women die 3 to 4 times more than anyone else as far as in maternity. And so when you think about that, what that disparity means, and seeing that at the root of it, studies have shown that it is a systemic racism issue not a health issue. Again, the infant and maternal mortality disparities in Black birth is not a physical issue. It's not a medical issue. It is a systemic racism and bias issue that we're facing. So having a doula there to help encourage you to learn and understand your rights, to help encourage you to understand your own body, and to reinforce the fact that you have body autonomy, to have your doula there to support you in saying, this is your plan, we're going to go with your plan, and encourage providers and encourage other people who touch that maternity to do the same, to support that autonomy, to support the emotional state of that entire family is huge, because a question, a resource, a referral, or a refusal may mean the difference between life and death for Black women.
Okay, thank you, Kelli. I'm wondering if we're going to open this up for questions in the next few minutes, but I'm wondering if you could speak a little bit more about how you're screening, or how healthcare providers should be screening for mental health concerns. So, you identify the ACEs questionnaire, which is an excellent way of getting a sense of somebody's history. Doesn't necessarily tell you what's going on right now, but I'm wondering if you, as a healthcare provider, could just talk about the screening and evaluation process, and also referrals, because the trust issue that you identify, especially with women of color, communities of color, is there, right? That referrals to mental health providers may not be, there may not be a lot of people who want to access care through the mental health system. So I'm wondering if you could just talk a little bit more about that.
Absolutely, absolutely. So as far as where maternity is concerned, what we know is that across the board, we're not seeing a long visit. So it starts with that visit where, you may see your provider for 5 minutes for a physical exam, for a vaginal exam, and then everything looks okay, great, and walk out. Very rarely have I been with a client in a room and heard the provider ask, how are you feeling today? And waiting for that response, right? How are you feeling emotionally regarding this pregnancy? How do you feel about being pregnant right now? At each stage, at each visit, because simply asking that question, and not a yes or no question, but asking those open-ended questions. How are you feeling about your pregnancy diagnosis? And waiting, being patient and giving time for clients to express that I'm not feeling well. And even if they're responding and saying, oh, I'm great, and you're noticing that maybe her face says that she's not feeling great, or maybe there's just one word, very curt, saying, okay, well, I appreciate that you're sharing that with me. Know that if that should change, know that if you're ever not feeling great, it's safe to say that to me. And if you don't feel safe saying that to me, here are 5 resources in the community that you can reach out to. And so I hope that if you feel as though you're not safe, or you don't feel happy in this pregnancy, that you'll reach out to them. And I'll always ask that of you, because I want to make sure you feel safe and comfortable with me, right? Because, if you're going to screen someone and they're afraid of you, you might get different results. They might be in a state of anxiety and they might just try to get it over with, right? They might just answer the question really quickly. So asking that question, how are you feeling about your pregnancy diagnosis? Or is there anything that you're needing to feel more comfortable with this pregnancy diagnosis? Those questions that are open-ended can lead to conversation and trust. And they can lead a birthing person to feel as though that is a safe place, or can become a safe place, right? So then later on, when you're offering the PHQ-9, or you're offering the Edinburgh Depression Scale, there's already been that door open. There's already been that communication established, where at least the effort was made to say, I'm hoping that this is well for you. I have an interest in your mental health. I know how important this is in your life. I know how life-changing this is. And I'm here to provide support and helping you find someone that can help you if if I'm not able to. The other thing about the referral is following up, right? So getting a pamphlet is not a referral. saying, here's this number, here's this provider. This is someone that I think that you might find good resources with. Would you like to contact them? Would you like my nurse to contact them? Are you able to set up an appointment? Is this something that you're able or comfortable doing? And then next visit, how did it go? Did you set that appointment up? Why or why not? How do you feel about that? What did you find that was good, or what might not have worked well for you? Those are very important questions, and that can open the door to that communication with providers.
Thank you. I would say that as a mental health provider who does work with this population, it means a lot to the patient population when their provider has said, here's a referral that I trust. So, that
Yes.
piece, Kelli, that you're touching on, the safety, that creating a safe environment, I really want to underscore that how important that is, and what role we all have, right? And whatever role we're working in, or even with our friends and family, that we all actually can participate in creating that safe environment, that trusting environment. So it's really an important point. Now would be a good time.
Absolutely.
Now would be a good time to ask people if they want to join the conversation. You certainly can do that. There is, you have the ability to put your video on and turn your, mute off if you want to join the conversation. So anybody is invited to do that. Lorelei did share a question here that I'll start with Lorelei's question. We now understand how prenatal trauma can cause long-lasting impacts on behavior, mental health, and development. However, I've not seen a change in mental health assessments that explore this with families. Any recommendations on mental health assessments that bring this to the surface?
So one resource that I can share is Postpartum Support International. This is a resource that basically focuses on postpartum depression and mental health and all of those things that concern the mind during postpartum. And these resources and things that they share can be used and tapped throughout their entire pregnancy. Sadly, I don't see many resources readily available that assess this in a way that is kind of community building and open to everyone, so much as we see just kind of the screenings that lead to a mental health provider. So that's more of the case where there's a screening and then there's a referral, but it's not so much where you're seeing that active interaction. However, again, Postpartum Support International does have wonderful resources, and connecting with community can help a lot, and making sure that mom is connected with just support systems as far as like discussion groups or things of that nature can help. Thank you for that question. Are there any other questions or?
How does somebody find a doula, Kelli?
Lisa, are you seeing me on your? So one of the ways you can find a doula is doulamatch.com. This is a platform that allows doulas to market their businesses and explain how they work and to be able to have someone explore their practice. And then also the organization that I certified through and support is Doula International. And if you go on doula.org, there's a tab where you can find a doula or locate a doula. And then also there are really great doulas that are connected with the Facebook group, Michigan Birth Professionals. That is really an amazing resource in our community that is headed by Deborah Allen, who is my doula mother, who brought me into the doula profession. And she handles that and makes sure that everything that goes on that site is evidence-based. And she has supported many, many doulas in getting resources and many families in finding doulas. And I see, are the services of a doula covered by Medicaid? you may have said, but I have rough connection. I apologize for the rough connection on my end as well. And so currently in our state, doulas are not covered by Medicaid. And so that's something that we're working to really remedy and kind of fighting to make happen. But currently, no, right now, doulas are not covered by Medicaid. Some insurance companies are able to be billed for doulas under a miscellaneous category, but I cannot speak to which ones really all do that because sometimes things change and I want to speak in error. But currently, Medicaid does not, unfortunately, to the chagrin of all doulas, um, um, cover for care, for doula care.
Yeah, I apologize. I'm not quite sure on whose end the audio it is quite glitchy. So I don't know if it's on your end or my end, but I do apologize for that. Lactation support is something else that you do and you haven't spoken too much about, but when we talk about the fourth trimester, right, that also includes lactation support. And I'm wondering if you can talk a little bit more about that.
Absolutely. And lactation support is extremely important because we know breast milk is first food, right? The natural first food for our babies. And choosing to breastfeed is an extremely personal and extremely emotional choice for any mom to make. What's sad is that there's a huge racial disparity in breastfeeding rates in inception, beginning breastfeeding, and duration, right? So Black moms get less support in breastfeeding, and the duration for breastfeeding for Black moms is also shorter. What is being recognized is that when we're going back to work sooner, breastfeeding is not supported. In the hospitals, we're not encouraged as much as other moms to breastfeed. And when we are encouraged to breastfeed, then we are under more scrutiny from providers to stop breastfeeding if providers say things like, oh, baby is failure to thrive, or baby is not gaining weight appropriately, when at the core of most of what I'm seeing in those situations is that baby has lost IV weight. So when mom has an IV, baby gets some of that fluid, baby can puff and swell, and then when that IV fluid is excreted and baby loses weight, then mom is threatened with, oh, baby's not getting enough, baby's not gaining enough. When we realize what's happening is that it's natural for baby to lose weight, especially that IV weight. And breastfeeding takes a little bit more time to gain that weight and sustain over time than bottle-fed babies. And so that's where we have this huge demand for, if we see anything wrong, you're going to have to be bottle fed. And they're sending, and most hospitals now don't send babies home with formula, but it's very, very prevalent that you'll see babies being given pacifiers or some kind of supplementation in hospitals when there's any chance that there's some weight loss, which there needs to be discussion about that and understanding of why exactly breastfeeding is not best. And can we simply pump? The availability of breast pumps for moms needs to be there as well. That support and lactation service has to be provided, and making sure that providers understand which drugs are not conducive to breastfeeding. What drugs given for pain or what have you can seize and dry up mom's milk, right? So those discussions need to be had. And quite often for Black women, those are not had as much. And there's a lot of pressure involved. We'll call CPS. There's the threat of having baby taken away because you're not being a good parent, because baby is losing weight. So again, that fear is introduced, and that pushes moms to cease breastfeeding earlier.
There's a question back to the doula of how do you suggest women of lower income who may have a lack of support or insurance to acquire that support?
Absolutely. So there are many doulas who will accept payment plans and do little by little. There are some doulas who accept scholarships or providing a gift certificate instead of buying the layette or the pretty things or all of that, for a birthing person, a gift certificate for half the cost of a doula, or finding a doula who is a community doula and who's doing this outreach, or one who would say, I'll be able to work with you, or bartering with your doula. Many options are available for doulas who would say, I'm able to provide scholarship or things of that nature.
Okay, Margaret wants to know, she has a client that is considered high risk due to hypertension, but is not on medications. Are doulas allowed for high risk clients?
Absolutely. Doulas support any and every client that is a good fit, high risk or not. And as a matter of fact, it's more suggested that a doula be present for a high risk pregnancy, just because they're helping with that support, with learning, with educating the client, helping to support the mental aspects of that. So absolutely, there is no case in which a doula is not suggested. Now, a doula may not be present depending on the hospital policy as far as C-section is concerned. There may not be able to be that support physically there if partner is already going in to support mom. But all the way up until that point, a doula is absolutely recommended. And then even afterwards, if mom does have a C-section and comes out, doula can be there to support that.
Okay. So Lucinda has a question about making mental health referrals, for pregnant and postpartum clients, and what's the best way to do that. So what I would suggest, oh, go ahead.
No, you go first, because this is your area of expertise.
Well, so Postpartum Support International, just to give you a little background, that is an international organization that actually does really comprehensive trainings. And there are certain certifications that you can get through Postpartum Support International. So on the Postpartum Support International webpage, you actually can go to your state. They have a drop-down list for each state. So if you go to Indiana, you actually can find mental health providers who have been trained through Postpartum Support International. So I would say to you that in my years of working with pregnant and postpartum women, PSI is really the best training for people to receive. It's 2 days, it's comprehensive, and you have an opportunity to do a certification. So Kelli and I have both done the training. Neither of us have actually taken the certification exam, but so it's, it doesn't mean that if somebody doesn't have a certification, it doesn't mean that they're not capable. But if they've done the training, then at least you as a provider know that they have some, solid knowledge about working with pregnant postpartum women. With depression, anxiety, any mental health concern is covered in the PSI training. So if you go to their webpage, Indiana, they keep a list of providers. And in fact, there's an Indiana group that has a Facebook page. And I think that group has also tried to keep an up-to-date list of providers. The biggest challenge is that this time, COVID-19, the demand for mental health care has skyrocketed. So it is, people's practices are full. And so there may be waiting lists, and the insurance does matter in terms of some barriers in terms of who accepts Medicaid, because there's certain regulations that go along with Medicaid that make it more complicated to find trained providers who also are able to take Medicaid insurance. There's, so that's a long answer. So Kelli, what do you want to add to that?
You literally took the words out of my mouth. I could not have said it any better. Thank you.
Okay, okay, so what types of groups or ways to access similar supports are there for those who may not have Facebook? There are Facebook support groups. I think that's a question, but are there other online groups that people can find out about?
I believe one of the resources that I would say that can lead to other resources is kellymom.com. Kellymom.com covers lots of aspects of maternity, and they may have resources for mental health as well. Unfortunately, this is a huge gap in our community. And so this is why, one of the reasons why we're having this conversation is because there's a huge chasm of where mental health is concerned. And we want to make sure that we close that gap for parents. And so I would say to go to kellymom.com and to go to PSI International, Postpartum Support International.com, and start there. That'd be a good place to begin.
Okay, so I want to, Emmy has announced here on the chat, the Indiana Minority Health Coalition has free community doula services available in St. Joe, Elkhart, LaPorte, and Cass counties for minority moms that are Medicaid enrolled or eligible. So that is www.communitydoulaservices.org. So I'm going to be sending out a list of resources this afternoon, and I'm going to include some of the things that have been talked about here. So I really appreciate if anybody has anything else that they want to put into the chat box. I'll take a look at that before I send out the email later today. So Kelli, we are actually at the end. So you have packed a lot of great information into today. We really appreciate you taking your time and sharing expertise with us today. It's such an important topic, and thank you for being here. I do want to let everyone know that we will upload.
Thank you for having me.
Oh, you're welcome. We will upload this recording to the MHAM YouTube channel. I'll send a link out, probably sometime over the weekend or on Monday. There is an evaluation we will send out. We work hard to get evaluations and feedback on our webinars. We do have an incentive. So if you fill out your evaluation by 5 p.m., you get a chance to win a $25 gift card. So please, and if you don't get a chance to fill it out before 5, please fill it out anyway. So I'll send out certificates of attendance. I'll send out resources later. And thank you, Kelli.
Thank you so much. Thank you all, and have a great day.
All right, thank you.